Today we're talking about Mounjaro, one of the newest and most effective treatments for type 2 diabetes. But it's not for everybody, and there are some side effects that you need to know about before starting it. So the question that you need to answer is if this medication is for you. We're going to try and help you answer this today by discussing what exactly it is, how effective it can be, and most importantly, what kind of side effects can you expect, so you can decide if you want to give it a try. Mounjaro or Tirzepatide was approved by the FDA in May of 2022 for the treatment of type 2 diabetes, and it's part of a class of medications known as GLP-1 and GIP receptor agonists. What this means is that it mimics two different gut hormones that help regulate blood sugar levels, making it one of the most powerful diabetes medications available. It works in three key ways. First, it helps stimulate insulin release when blood sugar is high. Second, it reduces how much glucose is produced by the liver. And third, it slows down digestion, which helps control appetite and leads to weight loss. Because of these mechanisms, it not only helps lower blood sugar, but also aids in weight management, which is a huge benefit for many people. Mounjaro is an injectable medication that comes in a pre-filled single-dose pen. It's taken once a week with doses starting at 2.5 milligrams. The typical dosing schedule includes increasing to 5 milligrams, and for those who need more blood sugar control, doses can go up to 7.5, 10, 12.5, and even the maximum of 15 milligrams per week. The gradual dose escalation helps minimize side effects while improving the medication's effectiveness. The injection is typically administered in the abdomen, thigh, or upper arm, and it's important to rotate injection sites to reduce irritation. Now let's talk about how effective it really is. Clinical studies have shown that Mounjaro can lower A1C levels by up to 2.1%, what makes it one of the most effective diabetes treatments available. Now, an A1C is a lab that measures your average blood sugars over the past 3 months, and lowering it significantly reduces the risk of diabetes complications like nerve damage, kidney disease, and vision problems. Not only does it help with diabetes, but research also suggests that it may have cardiovascular benefits, reducing the risk of heart disease, heart attacks, and strokes. This makes it a medication that offers multiple health benefits beyond just blood sugar control. Now, let's get what you really want to know about though, and that's the side effects. Most people tolerate Mounjaro pretty well, but there are some common side effects to watch out for. The most frequent ones include nausea, vomiting, diarrhea, constipation, abdominal pain, bloating, and heartburn. These side effects happen because Mounjaro slows digestion, which can cause food to sit in the stomach longer. But the good news is that for most people, these side effects tend to be mild and get better as your body adjusts the medication. Now, if you're experiencing nausea, there are things you can do to help, like eating smaller portions, avoiding greasy foods, and taking your time when eating can make a big difference. Some patients also find it helpful to stay upright for a while after eating instead of lying down right away. There's also a rare but serious risk of something called pancreatitis. That's when the pancreas gets really inflamed. It can cause symptoms like severe abdominal pain that doesn't go away, nausea, and vomiting. So if you ever experience any of these kind of symptoms, stop taking the medication and call your doctor right away. Another important consideration is who should not take Mounjaro. If you have a personal or family history of medullary thyroid cancer or something called multiple endocrine neoplasia syndrome type 2, you should avoid it. These conditions are rare, but since Mounjaro has been associated with potential increased risk of thyroid tumors in animal studies, it's best to be cautious. It's also not recommended if you've had pancreatitis in the past, since this medication can increase the risk of another attack. It's also important to keep a close watch on your blood sugars, especially if you're taking other diabetes medications. While Mounjaro on its own does not usually cause dangerously low blood sugar levels, when it's combined with other diabetic medications like insulin or sulfonylureas, it can increase the risk of hypoglycemia. Now, symptoms of low blood sugars include dizziness, sweating, shakiness, and confusion. If you experience any of these kind of things, check your blood sugar right away and follow your doctor's instructions on managing low blood sugar episodes. Now let's talk about cost, because this is one of the biggest issues with the medication. Mounjaro is expensive. If you're paying out of pocket, you're looking around $1,000 a month. Insurance will usually cover it, but it depends on your plan. If your insurance doesn't cover it, there are some manufacturer savings programs and some patient assistance programs that can help lower the cost. So definitely look at those if you're considering this medication. Some patients have been able to use savings cards to get their prescription for as little as $25 a month. So it's worth going to their website to see if you can qualify for anything like that. So the big question is Mounjaro right for you? Well, it is one of the most powerful diabetes medications available, offering significant blood sugar control and weight loss benefits. While it does come with some side effects and a high price tag, for many people the benefits can outweigh the risks. So if you're thinking about starting it, talk to your doctor and see if it's a good fit for you. And remember, medications are just one part of the equation. Lifestyle changes like diet and exercise are key to long-term success in managing diabetes. Even small changes like cutting back on processed foods, increasing daily activity can make a big difference. Now, if you're looking for ways to improve your health naturally, check out this video right here where I break down simple lifestyle changes that can help you take control of your diabetes. Thanks for watching, and we'll see you in the next video.